Okay, so I'm going to be giving Miss Agnes Ford's 12 o'clock medications. So first thing I'm going to do is compare the provider's orders with the MAR. Okay, so we have the regular insulin on a sliding scale before meals. Regular insulin sliding scale before meals. We have warfarin 7.5 milligrams daily PO. Warfarin 7.5 milligrams daily PO. Cephalexin 500 milligrams BID PO. Cephalexin 500 milligrams BID PO. Diltiazem 180 milligrams daily PO. Diltiazem 180 milligrams daily PO. Okay, so now that all that's correct, I'm going to go into the patient's room, perform hand hygiene, and I'm going to introduce myself. Good afternoon, Miss Ford. My name is Lauren. I'm one of the nurses. I'm going to be giving your 12 o'clock medications. Okay, so I'm going to get her to, Miss Ford, I'm going to get you to verify your name and date of birth. Okay, and I'm going to check that against her ID band, and that's correct. And I'm also going to assess for any allergies. So, Miss Ford, do you have any allergies? No, she does not. Okay. So what I'm going to do now is I'm going to look at the medications and compare it with any labs or vitals. So for insulin, I'm going to assess the patient for any nausea. I'm going to make sure her meal is right there for her to eat right after I give the insulin, and I'm going to make sure she's not in PO. Okay. And I'm also going to assess her blood sugar. Her blood sugar was 264, and on that sliding scale 264, I'm going to be giving 6 units. And then I'm going to go ahead and look at the warfarin. So for the warfarin, I'm going to look at the INR, and the INR is 1.2, and normal range is 1 to 1.2. And the cephalexin is for her UTI. She has to continue her antibiotic. Diltiazem, I'm going to look at blood pressure, and her blood pressure at 11:30 was 136/78. Okay, and now that I've done that, I'm going to go to the Pyxis. I'm going to pull all my medications. So I have the regular insulin, and that's going to be the sliding scale, and I'm going to be giving her 6 units since her blood sugar was 264. And then we have the warfarin 7.5 milligrams daily PO. We have the cephalexin 500 milligram capsule, and then we have the diltiazem 180 milligram capsule. Okay, and now that I have all the medications, I'm going to go ahead and take that to the room, and I'm going to verify the patient's name and date of birth. Once again, I'm going to perform hand hygiene again. So Ms. Ford, can you tell me your name and date of birth again? Okay, and I compared that with her ID band. You can also ask for any allergies once again, just to be sure. So what I'm going to go ahead and do is now that I've verified her date of birth and her name again, I'm going to check the medications again. Okay. So now that I'm in the room, I'm going to check again. So we have the regular insulin, that's the sliding scale before meals. And it's going to be 6 units because her blood sugar was 264. We have the warfarin, the 7.5 milligram tablet. Then we have the cephalexin 500 milligrams capsule, and then the diltiazem 180 milligram capsule. So now that I checked again, I'm going to go ahead and draw up this medication. So I'm going to wipe this top of the insulin, and while that's drying, I'm going to draw up 6 units of air. Okay. And now that that's dry, I'm going to go ahead and insert, and I'm going to inject that 6 units of air, and going to go ahead and pull up that 6 units of regular insulin. And I'm going to do a double check. So I have 6 units of insulin for Miss Agnes Ford. Her blood sugar was 264, so I'm giving her 6 units. All right. So now that I have that, I'm going to carefully recap. Okay, now that I have that, okay, so I'm going to go over to Miss Ford, and I'm going to do like the back of her arm. So she's already sitting up in bed. So I'm going to wipe that part with the alcohol wipe, and while I let that dry, I'm just going to let her know, Miss Ford, I'm going to be giving you your regular insulin, 6 units, since your blood sugar was 264. Okay, so I'm going to go ahead and give that. And the alcohol has dried, so I'm going to pinch the skin. And on the count of 3, I'm going to go ahead and inject your insulin. You ready? 1, 2, 3. All right, very good. And I'm going to put that directly in the sharps container. Okay, so now that I've done that, I'm going to prepare her other medications. And while I'm doing that, I'm going to check along with the MAR. Okay, so we have the warfarin, 7.5 milligrams daily PO. Got that. We got the cephalexin, 500 milligrams BID PO. Sorry. And I will be wearing gloves at this time. And then we have the diltiazem, 180 milligrams. Okay. And then I'm going to go ahead and give this to her with some water. Okay, Miss Ford, this is your warfarin, your cephalexin, your antibiotic, and your diltiazem for your blood pressure. Okay, so I'm going to go ahead and watch her take that, make sure she's not hiding anything under her tongue or anything. And after that, I'm going to perform hand hygiene, and I'm going to document in the MAR the time and the date, medication given, and my initials.